Hello, my name is Una Kearns. I'm the CEO and founder of My Patient Space, and we lead Work Package 2 of GerOnTe. Over the next few minutes, I will set out what Work Package 2 delivers, why it matters to the project, and how it connects to the other work packages that you can see on the website. First off, My Patient Space is an Irish digital health company. We provide a configurable multi-condition platform which consists of an app and portal that allows healthcare services to run integrated connected care beyond the hospital walls. It already supports cancer, respiratory and chronic disease programs at scale today. We joined the consortium in May 2024, partway through the project, when GerOnTe needed to replace its original technology partner, and we took over as the leader of Work Package 2. Our role is to deliver the tools for the GerOnTe intervention, software that patients, carers, and clinical teams use every day on a platform that's already certified CE marked and for the project is hosted on approved French healthcare infrastructure. The GerOnTe pathway is now live in all 10 trial sites across France. GerOnTe brings every professional caring for one older patient into a single decision centre, the Health Professional Consortium, so that the patient receives one harmonised plan rather than several competing ones. Coordinating that consortium is an advanced nurse practitioner acting as a case manager who coordinates between meetings and maintains the link between the hospital and the teams. This depends on everyone seeing the same information at the same time. Work Package 1 defined the care model. Work Package 2 turns it into a working system with two sides, an app for the patient and their carer at home, and a dashboard for the clinical team. The dashboard brings together the oncology information, the geriatric assessments, and inputs from the GP, alongside the patient's other conditions and the priorities that they have set for themselves. Everything needed for treatment decision sits in one place, rather than scattered across separate systems and separate consultations. Work Package 2 has three parts. Task 2.1 builds a tool and puts it into clinical use. Task 2.2 connects it to the systems hospitals already use. And Task 2.3 prepares the data for machine learning and decision support. I will take each in turn. Task 2.1 is the tool itself, and both modules are live. Patients and carers have access to an app on iOS, Android, and the web, which asks short sets of questions daily, weekly, or monthly according to the protocol. Where the answers indicate severe symptoms, the app raises an alert and tells the patient precisely what to do next. It also delivers personalised education. On the clinical side, teams see geriatric and oncological data, symptoms, progress, goals, and education in a shared view. The pathway is configured and deployed across all 10 French clinical sites, in English and in French, and it's built under our ISO 13485 quality processes and hosted on certified health infrastructure in France. And so far, feedback from the sites has been incorporated continuously into the project. The consortium meeting is where the GerOnTe decision is made, and an advanced nurse practitioner holds the case together between one meeting and the next. Ahead of the meeting, the dashboard assembles the full picture of the patient in one view: comorbidities, intrinsic capacity, frailty, prognosis, and the patient's own priorities, together with assessments such as the Lee Index and the chair stand test. The team works through a standard set of questions using the tool. What is the life expectancy if the cancer is left untreated, which is calculated automatically from the Lee Index? What is the burden of the cancer, and separately, the burden of the treatment? Does treatment add to life expectancy? What are the alternatives, including best supportive care? And what influence would the proposed treatment have on the patient's own goals? The answers are recorded in the system and saved to the patient record and shared with the whole consortium in both English and in French. The meeting produces one documented plan rather than a conversation that each participant remembers differently. Task 2.2 is interoperability, and it is where many digital health projects run into difficulty. Every hospital is different, especially across Europe, and they all run many different electronic healthcare record systems. In the project, we map what data each site already holds and where it lives and what can safely be exchanged. The system is being built so the data can move using standards such as HL7 Fire and SNOMED, the open international standards for health information. We've gone further and demonstrated in the project GerOnTe running embedded inside an EHR using Smart on Fire. In this model, the clinician doesn't need to leave the system they already work in, and this is the ideal. Where direct integration is not feasible, we are looking into practical alternatives rather than asking the hospital or the clinicians to change. All of this is aligned with the European Health Data Space. For the trial itself, GerOnTe runs standalone, and this work sets the path for scale beyond the trial. Task 2.3 looks past the trial. Everything the pathway captures, we are now mapping into structured, coded, and traceable form using FHIR and SNOMED, so that the meaning of the data travels with it. We are validating an architecture in which machine learning supports clinical decisions rather than replaces them. The design is aligned from the outset with the EU AI Act, the European Health Data Space, and the EU Data Act. The output is a demonstrator at the end of the project and a pathway able to keep learning. The GerOnTe pathway is in clinical use rather than in development. It is live in 10 sites across France, with both modules used daily. We delivered 7 training sessions over the past year, most of them on site, in English and in French, with printable offline materials for patients and staff who need them. And the platform has been independently security tested. Finally, how does Work Package 2 sit within GerOnTe? So 2 work packages shape the tool. Work Package 1 defines which data elements we capture and who sits on the Health Professional Consortium. Work Package 6 brings the co-design with patients, carers and clinicians, together with the ethical requirements we build to. 4 work packages then depend on what we produce. Work Package 4 uses a tool to run the Frone trial. Work Package 3 uses the data it generates to support health economic evaluation. And Work Package 5 draws on what we learn about deployment to build the EU-wide implementation roadmap. Work Package 7 takes it to market so the GerOnTe project outlives the project. All of this is coordinated by Work Package 8, which is led by the University of Bordeaux. Work Package 2 sits at the centre, providing the digital backbone the rest of the project runs on. Our team also contributes to deliverables and items across several of these other work packages. In the Frone trial, the tool runs a deliberately restricted feature set. The protocol fixes what patients are asked and what they can see and what is collected, so that all 10 sites deliver an identical intervention. That is a requirement of the trial design, not a limitation of the platform. The same base tool also supports 2-way messaging, telehealth, appointments, treatment scheduling, connected devices and wearables, medication reminders, e-consent, and optional AI with clinician in the loop. It is configured without code for any condition, any language, and any site. GerOnTe is one configuration of a platform already in service, with more than 35,000 patients on live pathways today, and having processed well over 30 million data feeds. I will close on exploitation, which is central to this project rather than an addendum to it. Getting these tools adopted and scaled across Europe and beyond is one of the aims of the work. A pathway that succeeds in 10 trial sites and goes no further has not achieved what it has set out to do. If you are working in this area on digital care pathways for geriatric oncology or any other complex condition, I would welcome the conversation. You will find us on LinkedIn and on the GerOnTe project website, or you can email me directly. Thank you for your attention. I hope you learned a little bit about GerOnTe and also Work Package 2. This has been a pleasure for us to be involved in this project, and thank you very much to the European Union for sponsoring this project.